The facial bone in lateral projection. Radiography of a lateral view of facial bone demonstrates the following. Fracture and neoplastic or inflammatory processes of the facial bones, orbits, and mandible are shown. The facial bone routine commonly includes a single lateral, whereas the skull routine may include bilateral position. The technical factors. The IR size 18 by 24 cm or 18 by 10 inches lengthwise. Moving or stationary grid. There are 65 to 80 kV range. Small focal spot and MAS is 8. The patient position. Remove all the metallic or a plastic objects from head and neck. The patient is erect or semi-prone, like this. Part of position. Rest lateral aspect of the head against the table or upright backy surface, with side of interest closest to the IR. Adjust the head into the true lateral position and oblique body as needed for the patient comfort. Palpate the external occipital protuberance posteriorly and the nasion of or glabella anteriorly to ensure that these 2 points are equidistant from the tabletop. Next is place support sponge under the chin if needed. Align mid-sagittal plane or MSP parallel to the IR. And align interpapillary line perpendicular to the IR. And adjust the chin to bring the IOML perpendicular to the front edge of the IR. So, this will be the facial bone lateral projection. The facial bone Waters method, Parieto-acanthial projection. In pathology demonstrated, fractures, particularly tripod and Lee-40 fractures, and neoplastic or inflammatory are shown. Foreign bodies in the eye also may be demonstrated on the image facial bone fracture. The technical factors. IR size 24 by 30 cm, 10 by 12 inches lengthwise, or 18 by 14 cm, 8 by 10 inches. Moving or stationary grid. 70 to 80 kVp range. Small focal spot, MAS is 18. In patient position. Remove all the metallic or plastic objects from head and neck. Patient position is erect or prone, or erect is preferred if patient condition allows. So, this will be the position, the part of position. Extend neck, resting chin against table, upright, backy surface. Adjust the head until MML or perpendicular to the plane of the image receptor. The OML will form a 37-degree angle with the table backy surface. So, just like this. In table radiography, position the MSP perpendicular to the midline of the grid or the table or backy surface, preventing rotation or tilting the head. One way to check for rotation is to palpate the mastoid process of each side and lateral orbital margins with the thumb and fingertips to ensure that these lines are equidistant from the table top. So, this is the facial bone Waters method, Parieto-acanthial projection. The facial bone modified waters. Position description. MSP and MML perpendicular to the IR. OML is 55 degrees to the IR. The CR is perpendicular to the acanthion or exit. The image evaluation, the facial bone with less axial angulation, petrous ridge below the inferior border of orbits. So, this will be the facial bone modified waters. The last facial bone. Reverse waters method. Acanthoparietal projection. Position description. MSP and MML perpendicular to IR. OML will be 37 degree to IR. Chin up or CR perpendicular to acanthion or in trans. So the image evaluation. Superior facial bones, same as true or original waters, but the image is magnified. Rationally for use. For patient who cannot be placed in the prone position. So, these are the example of the reverse water method, acanthoparietal projection.